Hey everyone, good afternoon. Emily and I will get started in the next few minutes. We're just waiting for everyone to have a chance to log on. Do you have a good day today, Emily?
I did. How about you?
I did. I have the best job in the world.
Yeah.
We could, with the people that are here already, we could just start by telling them a little bit about our book, which I have a copy of. And at the end of the webinar today, we're going to, the surprise at the end for all the early participants is, or for everyone, is we're going to, if you request a copy and send us your address, then we'll send you a free copy. Otherwise, you can also get it on Amazon or on Kindle, and we'll put the link up there. But really, Emily and I wrote this because it's all the things that we say every day to our patients, and we really wanted to share it with not only our patients, but patients that are cycling other places. It's just a tool to empower you and to teach you about your fertility and give you kind of a user guide or a field guide to what it's like to undergo this process.
Yep. It's a way for people to know what we say on a daily basis, to kind of come in with your eyes wide open to the process, and also refer back during the cycle when you have questions and you don't know what's going on, what's normal, what to expect. It's a way to kind of guide you through that process.
Yeah. And already I've gotten so many awesome notes and feedback and IMs, and patients are loving it. Modern Fertility just reached out, and they have a cohort of egg freezers that get together and talk, and it's been a big hit in that group, and people are really loving it. And I've sent it to other doctors and other healthcare professionals, and just getting lots of positive feedback. So it's been really
patients.
Yeah,
too.
and
patients come in and say, read your book.
Yes.
Really
everyone
good.
that freezes their eggs is really smart, but it's something so far outside of what we do every day. And it's a lot of new information. And I think people just think you just come in and decide and it's no big deal and you just do it. But it's actually a complicated process. And there's so many variables, and it's not the same for everybody. And it's so important to have it be personalized that this book really helps you understand your own fertility and where you're at and what the process looks like.
Yeah.
Yeah. Let's see. Do you want to show them some of your favorite parts, Emily, before we get started? We're going to start by introducing ourselves, but we'll wait and just like 2 or 3 more minutes till everyone joins us.
Yes, we're already getting some interest in the chat for the books, which is amazing. I think the plan will be to reply back to the email that you got with your address, and we'll take care of everything else.
And actually, they'll send out a new email after the webinar with a link to the webinar and a request for your address if you want a book.
Good, perfect. Well, yeah, my favorite part, well, we kind of divided and conquered. Dr. Lamb wrote a lot about testing and kind of interpreting lab results and things like that. And then I took on more of medications, injections, symptoms, recovery, kind of different things that basically I just get asked, as an IVF coordinator, coordinating egg freezing cycles all the time by my patients. So common questions, common mistakes, common things that come up, and, things that are very normal and that you might be wondering about. So I like the interpreting ovarian reserve section that Dr. Lamb wrote, because I think that's a huge component in understanding chances of success, what it means for the future, things like that. I think that's the most informative. And then beyond that, I just like kind of common questions and common mistakes, because I think those are things that can really help prepare you on what to do along the way, and kind of make things feel a little bit more manageable and more normal, as well as recovery. I think that's really nice, because people are really worried about symptoms that they're feeling. And that's really freaky if you're experiencing those things and you don't have a heads up. And so knowing what's normal and what to expect is really comforting. So
I really like the glossary of terms at the back. There's so many acronyms in our field, it gets really confusing. It's helpful for our new team members, our new nurses, not only our patients.
New language.
And I like the quick and dirty summary at the end.
Yep.
There's so many fun parts.
Yep.
So anyway, the best part about it is that it's short and it's easy to read, and that's like my type of reading style.
Yeah.
It's a book you can actually finish. You can read it quickly on an airplane, like, or wherever you just read a quick book. It's a great resource for patients. So I think we can get started. It's 4 or 5 after, and we're going to go ahead and just start by introducing ourselves. And this, certainly is going to be an informal talk, and we want to leave a lot of room for questions. We'll try to, wrap it up after 25 minutes and leave time for questions. But my name is Dr. Julie Lamb, and I'm a reproductive and an endocrinologist at Pacific Northwest Fertility in Seattle, Washington. I'm also clinical faculty at the University of Washington here in Seattle. And what a reproductive endocrinologist is, it means that you're trained as and board certified as an OBGYN, but then you're subspecialty trained in reproductive endocrine and infertility. And that's a 3-year fellowship. I did that in San Francisco, but I'm from the Seattle area. I grew up in Bellevue, and I'm happy to be back. I've been back for 11 years now, and I have one of the best jobs in the whole world, helping people build their families and plan their families. And I've worked with Emily for years, and she's one of my favorite people, and I'll let her introduce herself.
Very sweet. I'm Emily, one of the nurses here. Been here for a little over 6 years. Came here directly from nursing school. Just knew that I loved fertility, sent my resume, and prayed that I'd get a job, and it worked out, and I love it here. I have a passion for patient education. That's what I really love. I love talking to patients, going over things, making it more understandable, all those sorts of things. So yeah, I've been here for a little over 6 years. I live in the Seattle area, of course. And yeah, love fertility.
Welcome. Thanks everyone for joining us. This is kind of what we're going to talk about today. It's changed. The world's changed in our lifetime. And people went from having babies in their 20s to 30s or 40s, and how these trends, we're just going to look at them and better understand how fertility can change with age. And then I want to just talk a little bit about, like, why is egg freezing a thing? Like, why do you need egg freezing? Can't IVF just fix it when you're ready to conceive? And then what's involved, like understanding the fertility testing, understanding the IVF stimulation, what's involved with the procedure to get your eggs out, which we call the egg retrieval. And then what it looks like if you have to use your eggs, like how does that work? And then I think it's really important to visit the other side of egg freezing. Not everything is fun and easy, and not every cycle is successful. And there's lots of things that you should know about the downsides of egg freezing. And then we want to answer your questions at the end. So it's pretty interesting how population-based birth statistics demonstrate a consistent increase in the proportion of women that are delaying childbearing until later in their reproductive years. So egg freezing has been kind of touted as the next big thing since birth control pills, because it allows women to control their reproductive potential. So we saw it 5 years ago. When on the front cover of Bloomberg magazine, there was an egg freezing story, and we're seeing a lot of new books, and we're seeing it in the culture. So we're seeing a lot of older celebrities procreate at older ages, and they're making it look easy and simple and natural. And even if they'll give credit to assisted reproductive technology, they often don't share the part about them using a donated egg. So infertility declines with age, and they've kind of done a disservice to all of us as women by making it look so easy and natural. It's not. And oftentimes they struggle for years and don't necessarily share that part of the story. And then finally, recently, tech companies have been starting to provide benefits. And this started with Sheryl Sandberg at Facebook when she started the trend of tech companies starting to cover it to build their families and to support their female employees. So this is a graph that I think demonstrates well how the chances of conceiving change with age. So this is kind of fertility, the fertility rate, and it stays pretty stable until about 34 or 35. And that's where it starts to change significantly. And we see this red line is miscarriage rates. And so the abnormalities of the egg is a reflection of that increases with age. And so women, as they age, the quality of their eggs isn't as good, and it takes longer to conceive. They're more likely to have difficulty conceiving, and it's important to understand that, because I see a lot of women every day, even at the age of 38 or 39, we feel young, we look young, we're so fit, we're so healthy, but it just doesn't equal good fertility. And I think the celebrities make it look easy and simple, and it's not necessarily that way. And actually by 40, about half of women have difficulty conceiving. So the other misconception is that IVF can just fix it, that IVF at 40 can overcome your age, and the way it's helpful is you can get more eggs and maybe find a good one, but it takes more eggs to find one that will make a baby, and it's not as successful at 40 as it is at 30, even 39. And those years between 35 and 40, right here on this graph, make a big difference. And you see success rates. This is an old graph, but it demonstrates how success rates decrease with age using your own eggs when you haven't saved them. So if you are 40 and using your own eggs, it's a lot lower chance than if you are using your 30 or 35-year-old eggs. So it's important to understand that the uterus doesn't really age. It's really the ovaries that age. And when you use a young person's egg, so if I'm using a donor egg, that means I'm using a younger person's egg to conceive. And so that's how we used to overcome infertility in the 40s. And some of these celebrities, that's how they're conceiving in their 40s and 50s, is they're using a younger donor egg. So what egg freezing does is it allows you to serve as your own donor egg, saving your eggs from when you're younger and putting them in your uterus when you're ready to conceive. So really the goal of egg freezing is to give women that option to preserve their fertility and plan to delay, if they're planning to delay childbearing for whatever reason. So there's so many reasons. Every day there's a new reason. And I see a lot of shame around those reasons. Patients feel bad that they don't have a partner, but it's another big gender inequity, because no guy is sitting in front of me at 35 worried about how they're going to build their family. And so the fact that fertility decreases with age for women just doesn't seem fair. But there's a lot of other reasons that people delay, including career demands. I had a patient last week that's pursuing her PhD and leaving her job with benefits, or they're just not ready to parent yet. So there's a lot of really valid reasons. So it's important to know that most of women will consider trying on their own when they're ready, and they'll only use their frozen eggs if they're unable to achieve pregnancy. So you might freeze your eggs at 32 and meet someone at 34 and have kids at 36 and not have any challenges. But where we see problems is with it continued advanced age, and when they're trying for a second or a third in their late 30s or early 40s, we see a lot more women struggle to conceive. And that might be the time where we revisit those frozen eggs. So it essentially allows you to be your own egg donor in case you run into the fertility problems in the future. So you really need a crystal ball, because if you're not going to have fertility problems, then it'd be really nice to not have to use these. And certainly no one expects to encounter fertility difficulties, but it's something that I see every single day. And then what's amazing about it is it really provides a technological bridge from your reproductive prime to your preferred age of pregnancy. So it's empowering. It lets you choose, just like birth control on the other side of the age spectrum really allows you to delay pregnancy. This allows you to achieve pregnancy when you're ready.
Both ways of family planning.
Yeah, it's a great way of family planning. So who should consider it? This is kind of what we talked about already. It used to be for cancer patients, and now really for any reason. But there's a lot of reasons that we don't talk about very often. And I think it's important to know that there's a lot of medical indications. So not all of egg freezing is elective. We talk about it as elective egg freezing, but it's kind of a misnomer. We should really just say egg freezing, because there's a lot of very good reasons to freeze your eggs. So if I see a patient that's starting her journey to conceive, and she's 38 years old and her family building goal is 3, I know statistically it's going to be a challenge for her by the time, if it isn't already by the 2nd or 3rd. And so that might be somebody I talk to about their fertility preservation options. So if someone has a low egg supply, so let's say you learn about your fertility and your egg supply is lower than you anticipate. When that reproductive window is unclear, then we'll talk about what we might do to preserve it. Then there's lots of GYN issues that women can have, whether it's ovarian cysts or surgery on your ovaries previously that has a chance of reoccurring, or endometriosis. There's a lot of gynecologic disorders that disrupt fertility. And it's really important because to talk about these, because lots of times we don't know, the women's health is not at the top of the list of things people talk about. And so knowing that these things can affect your fertility and your future reproductive potential and educating yourself is an important part of this. So other things that we talk about is like if your mom or your grandmother had early menopause. Menopause usually occurs at 50 to 52. But really that reproductive window ends about 10 years before that. So if your mother lost her periods at 43, then we anticipate that potentially your reproductive window could be shorter, and it might be worth checking your egg supply earlier, or looking at your options for fertility preservation earlier. And then anytime someone's already having difficulty conceiving with the goal of more than one child, we look at options like this. And it's not that this is for everyone, it's just that you need to know about it as an option so that you can decide if it's right for you. So this is a schematic that Emily and I pulled from our book. And it's a little bit busy, and you don't need to read it, but it's just to kind of show you the timeline of egg freezing. So it's not something that you call the office and you come in for testing and you get your eggs out the next week. It's a kind of involved process. And that's why, one, it's not for everyone, but two, it's important to understand the many steps of it. So we're going to go through these steps, including kind of meeting with your fertility provider, like what goes on in that conversation, what do we talk about, and try to make it less scary. And then learning about the egg freezing process, which we'll talk today about, and then you want to learn about cost. And then you kind of make the decision about if it's right for you. And that's a discussion with you and your doctor. And if you don't have a good connection with your doctor, then you should find another one. You really want to feel like you have all your questions answered. You want to feel like you're heard. And then there's quite a few steps to cycle preparation. There's consents and ordering medications, and it's complicated. And when insurance involved, it makes it even a little bit trickier. So then we're going to talk about the stimulation process and how we grow the eggs. And, the big rumor is that the injections are so terrible. So we'll talk about those and why it can't be a pill. And then we talk about the egg retrieval and how the eggs are frozen. And then a little bit about afterwards, not only how do you use them, but what do you talk to your doctor about to make a good decision about what's next? Do you need to do it again? Are these enough eggs to meet your family building goal? So the first step to learning about egg freezing is really understanding your egg supply. And this is a 3-part process. The first 2 are blood tests, the AMH and the FSH. And the third is the antral follicle count. And that's an ultrasound, a pelvic ultrasound, which includes a transvaginal ultrasound, which is pretty common when you're pregnant. But since most of my patients that are doing this haven't been pregnant before, it's a new experience. It's not fun, but it's not painful. But it gives us a little window into that egg supply and helps us understand it. So specifically, AMH means anti-Müllerian hormone, and it is the hormone that's made by those resting follicles that we can see in this ultrasound. So they secrete a hormone. It's not that you just have this many eggs left, it's that cohort that's available for that given month. And then FSH tells us how hard the brain's working to recruit that follicle every month. But sometimes it's just as important to understand what these levels don't tell you. We use these levels in egg freezing to help determine a dose, to help counsel you on how many eggs you might expect to get. We use these levels to understand where you are in that reproductive window, but these eggs don't tell us if it's going to work. They don't tell us if you'll respond for sure. They don't tell us exactly how many eggs you're going to get. and they don't tell us about your fertility or your fertile potential if you were trying to conceive right now. But it can be really scary if you get a number that's abnormal, and it feels like it's telling you that you don't have good fertility, but that's not necessarily the case. So it's really important to remember that these numbers don't define you. We never base anything on just one test. And if it's funny, we'll recheck it, and you'll sit down and have a conversation with your physician.
I like to tell people it's kind of the best we have for counseling, but it's not perfect.
Yeah, I totally agree. So the next part is, how do we grow the eggs? So patients, all of our patients are type A and they're planners, and they want the calendar and they want to fit it into their lives. And so this just kind of gives you a little example of what it looks like. So basically, the hormone that you give yourself to grow the eggs is that same FSH that we measure in the bloodstream. And sometimes we start the process with a birth control pill, and that helps us line up the cohort so we can get it to grow together. There's a lot of different ways to start an egg freezing cycle, and so it's a discussion between you and your physician about what's right for you. There's a lot of things that weigh into this type of decision. On average, people do injections for about 10 to 12 days. And on average, you have 3 to 4 ultrasounds and blood draws. And that's kind of here with the asterisks. And that can vary. If they're growing fast, we might see you early. And this egg retrieval, when we get the eggs out, is scheduled just several days before. So your ovaries are on their own calendar, and we can say, well, they'll likely come out in this window. But that's probably the hardest part for patients, is just not knowing exactly what day it's going to be until a couple days before.
Yep, that's what most patients want to talk about the most, in that initial consult. It's a really busy few weeks, and it's often busier and longer than people anticipate up front. Mm-hmm. We know there's no perfect time in your schedule to do it, but trying to plan around, when work might be a little bit slower or less personal life commitments, usually helps a little bit to make it a little bit more manageable.
Yeah, especially, that's where I see the most stress around this process, is trying to hide this from work. The pandemic's helped a little bit because people are working from home, so it's a little bit easier to sneak away for appointments. But really making, whether you tell your work or your boss that you're having a procedure and that you need a few days off, or making that schedule a little lighter around the time that your eggs could be ready, does reduce stress. I think that's one of the biggest things patients can do to make the process easier. If you're having to, for my physician patients, when you're having to juggle a whole day of surgeries or a whole day of patients or a whole day of clients, it's a lot more of a struggle, a lot more stressful of a process than if you're, take those 3 days off and can take care of yourself and relax and focus on taking care of you and your eggs.
Yeah, and it's tricky because it's pretty unpredictable. So that's why kind of blocking off a little bit more time is really helpful.
Yeah, I agree. So this is kind of a little picture about how the ovaries work. So the ovaries have all of these little resting follicles. Every month you have a new group of resting follicles. And in the natural menstrual cycle, one follicle grows and it matures the egg. But not every egg makes a baby. So the whole process of IVF is getting all of those eggs and follicles in the eggs in the follicles to grow synchronously and grow together. So when they mature, we can retrieve them or get them out. So that brings us to the egg retrieval. So that's when the eggs are gently removed from the ovary. And this is done by transvaginal ultrasound guidance. So you can see the ultrasound probe in this image, and a tiny little needle guides right out of the end of it and goes into each follicle. So you can see that it doesn't go, it's a tiny little poke of a needle. It's not a big incision. I think it's pretty scary to have a needle in your vagina, so that's why women go to sleep for this. But it's not a big surgery, and the risks are related to bleeding or like the ovary bruising a little bit, which is really common, and it can be crampy afterwards. But for the most part, people take ibuprofen and recover and go back to work the next day.
Most people tolerate it really, really well.
Yeah, it's great. I'd say 95% of my patients go back to work the next day. This is a picture by ultrasound, and you can see I highlighted each individual follicle. So each one of these contains fluid, and the needle goes into each one and it aspirates the fluid, and with it comes the microscopic egg. And that egg is what we save for future fertility. So here's a picture of an egg. If you came back and needed to use your eggs, we thaw them and we take either partner sperm or donor sperm. You know, I get a lot of questions about using donated sperm, and we do a lot of same-sex couples, but we also do a lot of single females. So single mothers by choice is a big group in Seattle, and a lot of my professional women are choosing to parent alone and are finding support through groups like that. So when you're ready to parent, then we'll unfreeze these eggs or warm them up, and we'll grow them, and they grow for 5 days. And it's actually crazy because the egg is the biggest cell in the human body. We put one sperm in it and it grows for 5 days, and it's no different in size, but instead of one cell, it's about 200 cells in that same egg shell that surrounds the egg. And then if you're ready to use these eggs, we'll put it back inside the uterus. And this is the easy part. Like, it's done under ultrasound guidance, and a tiny little catheter kind of feels like a pap smear, and we slide it up into the uterus while watching from above with an ultrasound. Doesn't hurt. Much easier than getting the eggs out. You are awake for it, you go home, and don't need any time off work unless you want to rest and think about how lucky you are to be almost pregnant. This next slide is just things you should know. I think it's really important to know that the success rate really varies on age. So we looked at those age slides at the very beginning, but the success rates vary widely, and not just on age, FSH, AMH, but also on per individual. There's a lot of biological differences. There's a lot of women who by 37 have really low egg counts and maybe should have done it earlier. There's a lot of women at 30 that maybe don't need to do it because they have a partner and they're thinking about trying in 2 years. So learning about your fertility, learning about how age affects it, talking to a provider or a physician about your goals, your family building goals, and kind of what you're thinking, and then adding all the age, the FSH, the AMH into that plan helps us create an individualized plan for you. So sometimes, you know, it's not wrong to freeze your eggs at 40. It's just not as successful as at 37. So occasionally I will have a 40-year-old that will freeze her eggs when it's only a 30% chance of success given her egg supply, and she'll want to do it even though it's only a 30% chance. And other women at 35, and you know, they get 10 eggs and it's only a 50% chance, and they might choose not to do it because it's only a 50% chance. So your threshold for where it makes it worth it for you is important to consider. It's not the same for everybody. And then we talked about this, how just not everyone will use their eggs. It's possible. It's very possible for someone to not need their eggs and get pregnant on their own. And then it's important to understand that there's no pregnancy guarantee. The process is inefficient and isn't always successful. And it's important to know that you could save 20 eggs and have a 90% success rate, but still be in that 10% where it's not successful. So there's not a pregnancy guarantee. Or you could be the person that's 40 and just froze a couple eggs and the chance is less than 10%. And they still get a baby. So it's an all or nothing process. And when it doesn't work, it can be really sad. And I think that's why it's important to really acknowledge the downsides of fertility preservation. It's not a perfect process. It can be physically and emotionally demanding. It has side effects related to bloating and fatigue. It's not 100% successful. And then there's maternal and child health outcomes that change with age. So even though you're freezing your eggs at 35 and you have that 35-year-old success rate, the risks when you're 42 and putting your embryo back, those risks related to carrying a pregnancy at an advanced age increase. And they're not huge, but they're significant and they're worth talking about and talking to your doctor about. And we like it when you use your eggs before 45 because we do see a lot more complications with advancing age. And then there's some early reports of decision regret. So these are patients that go through the process and regret doing it. It's pretty uncommon. I don't see it that often, but it's not a fun process, and it brings up a lot of emotional pieces to your life. And so I encourage people to talk to their counselor or their therapist. And usually if people regret it, it just didn't go like they were hoping. They didn't get as many as they wanted. They felt worse, or just the process was harder than they expected. And then it's cost prohibitive. So just like every medical procedure or medical care, when it's out of pocket, instead of being covered by insurance, it's expensive. And so learning about the cost to figure out if it's right for you. It's a lot easier to do it when your insurance covers it and it's free. So Emily's going to talk about, what we didn't talk about today that you can kind of read about in the book. I'll let you take it from here, Emily.
Yeah, so these are just different sections within the book that we cover. So preparing your body for egg freezing, we kind of briefly touched on that. One of the biggest things is scheduling. So trying to reduce stress. It's impossible to eliminate it, but find a buddy to go through the process with you, someone you can talk to, whether that be a counselor, a partner, a friend, a parent, a sibling, who knows, your doctor, your nurse, but outside people too. Trying to reduce stress, focusing on health, trying to eliminate alcohol, minimize caffeine, supplements, just different tips and ways to kind of optimize your health before starting the process. Medications and how they work. There's different medications that function differently in the body, of course. And so just having a little bit more knowledge about what they're actually doing and how they're impacting your ovaries and your estrogen blood levels and things like that is helpful. It makes you feel a little bit more in control. Injection tips and tricks. Usually for most people, this is the first time that they've given themselves an injection. So, there's resources out there, videos, written materials. You can meet and talk with your nurse or over Zoom, these days, or whatever it may be, just to kind of go over the process. It can be a little bit intimidating, before you're getting ready to do that. But people usually do really well after the first couple shots. Most of them are little needles, some a little bit longer, but usually it's about 2 to 3 shots a day during that roughly 11, give or take a couple days on either end, stimulation phase. Planning for recovery. Mostly just knowing what to expect is really helpful, and knowing that what you're experiencing isn't abnormal. A lot of what we see, kind of the most common symptoms, are headaches and bloating and fatigue. Your body's working really hard during this process, so that's why the rest is important, and fatigue comes along with that. Sometimes some headaches and changing estrogen blood levels, and bloating just as the ovaries get bigger than what they're used to being. So that, makes it a little bit uncomfortable. And so we go over kind of tips to reduce that and prevent that. Some of it's normal, but just going over a lot of that. Breakdown of cost. Varies by clinic, how to choose a clinic, things to look for, finding a physician and a team that you trust, an embryology lab that has experience is crucial. And so just kind of looking at some of those different factors and finding a place that you feel comfortable with and confident in to take really good care of you. And then understanding success rates. That's huge. I think that is one of, what can be the most frustrating is we just don't know how the eggs are going to work when we use them in the future. And so understanding what those chances look like and just how to interpret the ovarian reserve and what those chances of success might look like for you, at least it helps to give people realistic expectations. And so we always hope for the best and we want the best, but at least having realistic expectations is really helpful. So those things and more.
Yeah, that's great. I think it's such an important decision to make to do this. It's okay to ask lots of questions. It's okay to learn about it and think about it. It's not something you have to walk in and be ready to do. So we want to take your questions after this next slide. I'm going to go over next steps and like what you would do if you're considering this. But drop your questions in the chat and we'll spend some time answering them. Emily and I would love to chat with you. So the next steps, like what's next? I think it's really a hurdle sometimes to pick up the phone or, email the clinic and make an appointment, but talking to a fertility specialist, even if you decide to never do this, it's important to understand your fertility. And it's important to understand the option and help. The more you learn about it, the less scary it is, and the better gut feeling you have about if it's right for you. And what I see is people have been thinking about it or testing their fertility, and all of a sudden they're 42 and they haven't done it, and they've been thinking about it for 5 years. So put in the time when you can and when you're younger, and learn about it so you can kind of fit it into your life and the cost later on. So someone's trying to get a hold of me from the front desk, but we're doing a webinar. The next slide, or the next step, is just learn about your fertility. So really take the time to just learn about your fertility and learn about your egg supply, understand what your numbers mean, kind of figure out what your fertility plan is. You know, we spend our whole lives getting told to plan for our financial futures, but no one tells you to plan for your fertility future. So think about how many kids you want. Learn how hard it is at the age you think you want to have them, or when you're done or accomplished your career goals that you want to. And if you don't have a partner, think about saving something too. So, and then educate yourself about the process. Learning about it makes it not as scary. Learn about the costs, figure out your insurance coverage, and make a plan for with your doctor that's right for you. Whether it's rechecking them in a year, whether you already know you want to do it, personalizing the protocol to your specific needs, what you're worried about, like talking about all that ahead of time really relieves some of that anxiety. So knowledge is power, and understanding your body and your fertility potential is critical when you're making educated choices about your future and your reproductive health. So in conclusion, egg freezing provides women with another proactive reproductive choice. It allows them and empowers them to make a better plan for their future pregnancies. So thank you so much for joining us today, and I wanted to take questions.
Yeah, I saw a really good one already that comes up all the time, and it's, does this hurt your future fertility potential if you freeze your eggs or you go through an egg freezing cycle? Mm-hmm. That's actually in our book in the common questions, but no, they haven't seen that hurts your future fertility, and that's something that people think about and worry about all the time. We're taking advantage of eggs and follicles that are available with that one cycle that otherwise would just be lost. So it's not taking some from a future fertility reserve or something like that. It's just taking advantage of what's currently available.
Right. And that's actually like the reason that this is limited and different for everyone. You know, everyone on this call probably has hundreds of eggs left, but we can only access that cohort that's available that month. So if that cohort's small, it makes the process less efficient and less successful. And when the cohort is big, that same number would die anyway that month. So rescuing them and getting them to mature inside of you and then using them to help you build your family in the future is how it works.
So a few questions in here on cost, Dr. Lamb.
Yeah, Kyle was going to talk a little bit about that, but he had to jump away. But the cost of the whole process, it varies. There's so many pieces that go into it. Just the medication alone. Actually, I have an extra slide on this. Let me pull it up. So the cost of egg freezing really varies by clinic. It matters what medications are covered. So some patients need a lot lower medication dose because their egg supply is different. And this might be a third of the cost. The clinic fees might be different because your insurance might pay for part of it. But you have to factor in outside costs, like how expensive it is to store your eggs. And I actually think when it's an out-of-pocket cost, you really have to look at the future costs too, like not only storing that eggs, but also if you're going to use those eggs sometime, just to thaw them, put the sperm in. ICSI is ICSI, it stands for intracytoplasmic sperm injection. Just the medications and transferring the embryo can be quite costly. So many insurances don't cover this, but many do. So I even have had patients switch jobs to get coverage, learn about their fertility and find coverage to be able to do something like this. So yes, cost is a big question. So thank you for asking that. I'm going to stop screen sharing so we can kind of see everyone on the call. So one of the questions that just got posted was, I'm just going to read it. And then we'll answer it. I was under the impression that side effects include mood swings and weight gain. How common are the severe weight gain and mood swings due to the medications and injections? And should I plan to lose weight first before starting a procedure to freeze my eggs? That's a great question. So first of all, the mood swings are related to the hormone levels. And sometimes patients, the most common thing is they get a headache when they first start, or they get fatigue. Very few people feel angry or tearful or really moody. That comes from IVF process, when it feels like such a last resort to build your family. And it feels like if it doesn't work, you're never going to have the family that you desire. And that's where some of that stress plays into the moodiness and the anxiety levels. The medications themselves are just medications that are hormones in your brain anyway. So they don't have, it's like insulin. You can't swallow it, you have to inject it. But it affects the growth of the ovary, and that's why people feel bloated and they fill with fluid. That picture that I showed with all the little follicles, each follicle grows to about 2 centimeters. So your ovary might be about this big. So you feel that, and that causes some people to feel more bloated, and some people don't even notice. Everyone's different. But that is just fluid shifts, and after the procedure, that goes away. So it's nothing permanent. The question about losing weight before you start this, it is good to be at a healthy body weight. You respond better to the medications. But I don't think you have to diet before you do this because you're worried about some weight that's permanent that you're going to gain related to the hormones. That's not the case. Your hormones are elevated for a couple of weeks, and then they return to normal, and so does your weight.
Yeah. A lot of questions about IUDs or birth control that you're currently taking. And a lot of that is circumstantial and kind of depends on what it is, what your egg supply looks like. Sometimes we do leave IUDs in place during cycles. Sometimes we recommend taking them out, just kind of depending on what your ovarian reserve might tell us and kind of what would be the most beneficial for your cycle and as far as highest chances of success.
Yeah, I agree. It's really personalized. There's lots of data that for a lot of patients, we don't need to take them out. They can cycle with them in. But someone who's paying for this out of pocket and it's expensive, or their egg supply is lower than they want, then sometimes we talk about the option of removing it in case it would get us a couple more eggs. Someone asked if you have to pay for a consult for a fertility clinic or it's covered by your insurance. That's a great question. Most patients that I see, I would say like 95% at least, have that initial consult covered. We bill it as procreative management or fertility counseling, and lots of patients have it covered. It's really important to know about costs up front. And so if it's not covered by your insurance, it's nice to know and prepare for what that cost might be. And so you can call and talk to a financial team member. They can help you look at your insurance. They can help you figure out your benefits even before that first appointment. There's some fertility checking you can do that's just at cost, so you can get this information. And that's pretty easy to do. And now there's even online, like Modern Fertility, you can send away your blood and get testing back. So there's a lot of ways that women are empowered to learn about their fertility, and it's just finding the right one for you. But ideally, it's with a conversation with a physician, so you just get all your questions answered. The next question is about supplements, like what should someone take before egg freezing and for how long? So this is a question we get an awful lot and that we spend a lot of time thinking about, but there's really not a lot of evidence related to this. And we address it in the book and discuss what the common things are that we'll recommend. You know, a lot of it is being a healthy body weight and not smoking and minimizing alcohol and being on a multivitamin or even a prenatal vitamin. And then we look at, you know, we're in Seattle, everyone's low on vitamin D, so we'll add that. And there's some evidence that CoQ10 might be helpful in egg quality. So when we're doing everything possible, we might add that. Then there's a lot of supplements that are used for different reasons. And in the consultation, we just kind of talk like what might benefit you the most? What are you worried about? You know, if your egg supply is lower, the supplements might be a different recommendation. But there's really not something that you're taking or not taking that makes it work or not work. It's just that when you're doing a complicated, expensive process, you want to have the best success rates possible. And to optimize your success rates, we have that discussion. So the next question is, have you seen success in more eggs in back-to-back cycles? I'm about to start my third cycle, and my AMH is 0.1. So that's like on the lower edge of normal. And I have 4 follicles in each ovary at my last check. So this is someone who's cycled before and is planning another cycle. And her doctor suggested that she might consider a second cycle immediately after this one. And she says, I'll be 40 in 2 months. I'm not opposed to that, but I'm curious about your thoughts. So there's a lot of things that we try to optimize the cycles. And that's one of the more recent additions. I don't think that we don't have evidence-based studies that show us that the egg number increases, but we do know the longer we wait between cycles, every month or every couple months makes a difference as you turn 40. You're not going to turn 40 and fall off a cliff or decrease your fertility. But one of the things we'll try is kind of like priming. It's like if your ovaries responded good 1 month, would they respond again if you did it right away? And that the data we have on that comes from cancer patients that are really trying to preserve their eggs before they undergo chemotherapy or fertility toxic cancer treatment. And those show those studies show equal success rates. I don't think that there's been a study that's shown significantly better egg returns. But it's something that we'll talk about with patients, and there's other benefits to it. So, depending on where you start in the cycle, and it's just very individual. So certainly when the egg supply isn't as robust as you hope for, there's a lot of different ways to look at it, to try to optimize it so we can get as many as possible.
Another question here about what if you only have 1 ovary? How does that impact your chances of successful egg retrieval? Is that still an option? Yeah, it's still an option. You would just do the same thing, do a consult, look at where your egg supply is at, even with that 1 ovary. And it may even be more ovaries than you may want to consider it. It kind of just depends. Everybody's different, but it's absolutely still an option.
Yes. And sometimes that other ovary kind of takes over the function of the one that you had removed. But, I would consider that a medical indication for egg freezing, because whatever caused you to lose your 1 ovary, often there's a risk that it can affect your other ovary. So, when you have it's the less renewable resource. So making sure that you talk to someone and figure out if it's right for you before your other ovary has any challenges.
What happens to your eggs or ability to use them if you move away from the Pacific Northwest? So couple options. We always say it's nice to keep them where they were frozen, and the lab can then use them when they're creating embryos in the future. So sometimes people establish with a clinic near where they live, and they do testing there or ultrasounds there, and then fly here for an embryo transfer. Or sometimes people choose to ship them, and that happens a lot too, and they can be taken to a different lab. Yeah. So it's just kind of weighing the different options with your provider and kind of what might be the safest and most comfortable for you, but they could either be used here or used somewhere else.
But it's not like you can take them and keep them in your freezer at home. They're precious and fragile. And, it's a conversation with your doctor. If you're going to move them, like, I want to talk to the lab. I want to talk to the doctor where you're going and make sure that they feel comfortable with our freezing protocol and they have as a high success rate. And so I think as egg freezing gets more and more successful across the board, we'll see more people requesting to move their eggs. But I certainly don't want to accept someone's eggs, and if they didn't survive, I don't know if it's the patient and some underlying fertility issue, or if it's just the lab that froze them is so much different and not as successful as ours. So you really want to ask those questions, and your doctor can help you figure that out. Lots of good questions. What a fun conversation. Like, certainly we can continue this and do it again. And certainly we're happy to answer your questions in person. We'd love to send each of you a book. They're going to reach out to you by email and just thank you for coming to the webinar. And then we'll just, if you reply and send your address, we'll send you a copy of our new book. And it's short and sweet. We kind of talked about it before everyone, as people were jumping on the call. It's easy to read, and it just really serves as a guide for you when you're going through the process. If you get a low egg supply, you can kind of look up and understand what that means. If you want to understand why or why not to take a certain supplement, all those little details are outlined here. and a really approachable guide. So I think that's probably reasonable to wrap it up, and thank everyone for coming. And it looks like there's tons of other questions coming in. Patrick texted that the Q&A has quite a few.
Couple questions about how long they can stay frozen for. That's a great question. Indefinitely. I mean, it's really a new technology, but you know, they don't have an expiration date.
Right. And there's been babies born 20 years after being frozen, but certainly we want them to use them. We want you to use them at an age where it's safe for you to carry a pregnancy. So the next question I got are, what are the top things to look for in a great clinic? So I think you just go talk to the doctor. Before you go in, you want to check out and make sure they have an excellent embryology lab. One good way to do that is look at their frozen egg success rates with donor eggs, because that's more equal across the board. You know, egg freezing is still pretty new, and it's not always reported in the CDC data very clearly. So really asking your clinic and asking your doctor how many live births they have from frozen eggs. There's a lot of places that really do a good job of seeing patients and freezing eggs, but very few clinics and doctors that do an excellent job of making babies someday when you need them from those frozen eggs. So that is number one. Number two is having a connection with your physician and feeling heard and feeling listened to, and getting your questions answered. You know, I tell patients to ask who their point of contact is, and who are they going to call if they have questions, or email, and how are those questions going to be answered. And understanding that and understanding the process makes it much easier. And if you have a good feeling, then no one is offended if you get another opinion, and find somebody that you feel like it's a good fit for you. Okay, so we're going to answer 8 more minutes of questions, and we'll do a hard stop at 5. But so many great questions here. Here's a question. Will you work with patients that are 44 with an AMH of 1.4 and 10 eggs? And what's the oldest patient you've had that's had success? So these are hard questions to answer, because you always feel like you're going to be the 1% that's successful. But yes, we see patients that are 46 and successful, but we see patients that are 36 and that are unsuccessful. So having that conversation about what your success rates are with your specific egg supply is important.
When can I start considering embryo or egg freezing after delivery? That's a good question. If people are breastfeeding, we usually recommend they've weaned, and you know, there's just a lot of hormones going on with that too. And then coming in and kind of having a consultation, and then usually we kind of make a timeline from there.
I have a question about typical success rates. So a woman in her 30s. So between 30 and 35, if you're able to freeze 20 eggs, so that's usually 1 to 2 cycles, that gives you a 90% success rate. But after that, that's when it changes. And by 40, it's probably 30 to 50%. So we have the graphs in the book, and it kind of goes through, and there's actually an egg freezing calculator that Harvard has with all the current papers. If you just type in Google egg freezing calculator, you can put in your age and you can put in the number of eggs, and it will tell you the success rate based on the current literature. But it's pretty surprising that 10 eggs doesn't equal 10 babies. People are always shocked by how inefficient this process is, just like IVF. It takes a lot of eggs to make a little human.
Mm-hmm.
I got a question about DHEA and Clomid in the egg retrieval process. These are both things that we use every day and have different indications. Usually these are for patients with a lower egg supply to try to activate the ovary and get more to grow. Someone asked, what are the supplements that you should take before egg freezing, and how long before? So certainly a prenatal vitamin. You want to be like, have a nutritious diet and eat organic foods and do all the things that you feel make you healthy. Multivitamin is the biggest thing. Certainly there's a lot of other supplements and we list them out in the book, but some of them we talked about earlier in this webinar, but it's really individualized for individual patients. And so it's something that you and your doctor discuss.
Couple questions about timeline. What is the general timeline from start to finish of an egg retrieval? It varies depending on how we lead into it and kind of the preparation phase, but usually it's about 4 to 6 weeks from kind of starting the preparation, ending with an egg retrieval. And people usually will get a period about 5 days to 2 weeks after the retrieval. So that's kind of like a recovery phase. So it's usually a lot longer than people expect up front. And then of course there's, preparation, testing, waiting for the consult, planning when to start, those types of things in the front end. But the cycle itself, including the preparation, most of the time is about 4 to 6 weeks. Another question on how long does it take to get a consultation? It varies, wait times vary, and there's often, cancellations and things like that move things along, but
quicker doesn't necessarily equal better. If you can get in right away, it doesn't mean it's a better doctor or a better clinic. Sometimes the good doctors are worth the wait.
Yep. Yeah, and it does feel long, but it goes by quickly. It's a busy process, and so communicating.
And during that time, you can learn about the process. A lot of patients come and do their testing ahead of time or with their general practitioner. They'll order the labs that we talked about today and come in with them. And that kind of moves things along. So the more you know about the process, the easier it is to move the process along. When you come and you've done no testing and you don't understand egg freezing or the process, it probably takes 2 or 3 months from start to finish or longer, depending on how motivated a patient is to do everything. But if you come and you've had your testing and you're ready to go, then oftentimes you can get those eggs out quicker. But it's not something that you want to rush. It's something that you want to be really thoughtful about.
Yeah, I think that's a good point. Sometimes it does take a while, but it's,
right. It's worth it.
Good.
Yeah, there's a lot of things that are involved in this process, and it's not something you want to rush into. It's something you want to prepare yourself for, and you want to know about the injections. That's when people feel the most anxious, is when they are moving so fast, the little details slip by them.
Yeah, it's the anticipation and the lead up that I find, is the most stressful for people. And that's why, the education up front can really kind of be a relief and help along that during that portion.
Oh, this is a good quote to end on. This says, not a question, but I read the book a few weeks ago and I thought it was fantastic, very informative, and I've already recommended it to friends. So thank you.
Thank you. That was the goal. You're very hopeful that it would just make it a little bit easier for people to understand and just be helpful.
Yeah, so thank you for that. We're getting lots of fun, positive feedback from all over the place. So if you want to leave an Amazon review, that would help. I guess that makes it come to the top of the list so more women can see it. We'll do talks. So if you work at a place and you want your colleagues to learn about egg freezing, we've done, I've done Facebook before and Amazon, and just teaching women. It's not that egg freezing is right for everyone. It's that everyone deserves to understand their bodies and their fertility.
And their options.
Before they're 45. So, and a lot of us spend most of our lives in our 20s and 30s planning not to have kids, and that changes, and you just don't understand. And it might just be you met the right person at 42. So if that has a chance for changing for you, and I'm sure if you want children, this is one more thing you can do to prepare. So, well, thanks so much for everyone for joining us. There's still other questions and comments coming in, and we'll look for more ways to do more educational. We can do an Instagram live. But yeah, you can follow Emily and I on our Instagram pages. Hers is Ask Nurse M, and mine's Julie Lamb, MD. You can follow Pacific Northwest Fertility. We're really big on empowering women and educating them. And so we're happy to help. So thanks for joining us tonight.
Yeah, thank you guys so much.